I wrote a script for this because I take this seriously. Schizophrenia is a chronic mental disorder characterized by psychotic symptoms, perceptual disturbances, auditory, visual, and or other sensory hallucinations, delusions, disorganized thinking or behavior, and flat or inappropriate affect. Affect is how I'm talking to you now. Affect is just someone's overall, general demeanor. Onset of schizophrenia is usually observable in men around their late adolescence to mid-20s and around mid to late 20s for women. Symptoms typically surface gradually and worsen with time. Auditory hallucinations are most common, followed by visual hallucinations. Everyone's experience is going to be different. I'm just trying to lay out statistics in this video. There is not an objective diagnostic test. Diagnosis for schizophrenia is based on observed behavior, a psychiatric evaluation that includes the individual discussing their entire personal history, and usually reports from family members and or other associates. Historically, schizophrenia was classified into 5 different subtypes: paranoid, disorganized, catatonic, residual, and undifferentiated. Today, however, it's recognized as a spectrum disorder, meaning individuals with the illness can have a vast range of symptoms without being labeled as something that might not actually properly describe them. 1 month or less of symptoms is classified as brief psychotic disorder. 1 to 6 months of symptoms is classified as schizophreniform. This literally translates to schizophrenia forming. Statistically, it's reported 1 in 3 people may recover completely from schizophreniform within 6 months. 6 months or longer of symptoms is when the diagnosis would be schizophrenia. Many individuals diagnosed with schizophrenia also have other mental health conditions, especially mood, anxiety, and or substance abuse disorders. Depression, paranoia, and or bipolar disorders are common. Psychotic symptoms, which is a fundamental part of a schizophrenia diagnosis, are categorized into 3 classes. Positive symptoms, which add something to the situation, such as perceptual disturbances or hallucinations, delusions or false beliefs, paranoia, mania or psychosis, anxiety, etc. Then there's negative symptoms, which reduce something, such as lack of interest in daily life, lower motivation, social isolation, reduced motor function, and reduced emotional expression. And finally, there's disorganized symptoms, which include chaotic thought and or speech patterns. During a psychiatric evaluation, the diathesis stress model is used to determine which traumatic events in someone's life resulted in the onset of psychotic symptoms. This considers the combination of biological and genetic vulnerabilities as well as environmental stressors that contributed. Most people diagnosed with schizophrenia have the illness for the rest of their lives and have a 20 to 30 year shorter life expectancy. Antipsychotic medications are used to reduce positive psychotic symptoms. Counseling, life skills training, and or antidepressant medications are the most common treatment for negative psychotic symptoms. There is no set treatment for disorganized symptoms. However, those would be addressed during counseling. Now, I would really like to talk about schizoaffective disorder, which is the combination of schizophrenia and a mood disorder, being either major depressive or bipolar. The two subtypes, of course, being depressed type and bipolar type, meaning someone diagnosed with schizoaffective disorder will have schizophrenia as well as bipolar disorder and or major depressive disorder. I'm just going to give you a general summary of depression just because I really would like this whole video to actually be informative and hopefully actually helpful. Depression reveals itself as a lingering low mood, low self-esteem, loss of interest in normally enjoyable activities, low energy, physical and or emotional pain without a clear cause, disturbed sleep patterns, self-harm or suicidal ideation, and so forth. Bipolar disorder is characterized by both periods of depression and periods of abnormally elevated mood that each last from days to weeks, and in some cases, months. Those with bipolar disorder can experience extreme mood swings triggered by even very minor events, such as just a thought or sound. For those with bipolar disorder, it can be incredibly difficult for them to control the extremity of their emotions and the actions they then perform. The rate at which they experience mood swings, or how long each particular mood lasts until they either start to relax or their state of mind becomes worse. Prolonged elevated mood swings can lead into mania, where they often experience high energy, racing thoughts, reduced sleep, intense irritability, impulsive behavior, and rapid speech and movement. Manic episodes can last from one day to several weeks. Prolonged mania can lead into psychosis. Psychosis is where you experience all of these symptoms of mania, except a lot worse, and also wild delusional beliefs, increased hallucinations, extreme paranoia, often very little if any sleep at all, intense anxiety, and sometimes suffocating suicidal ideation. Periods of psychosis can last from weeks to months and can sometimes be followed by a calm down of just mania. Of course, all of these symptoms can be very damaging to the lives of those diagnosed with schizophrenia or schizoaffective disorder. Now, this is very important, like it really is. Antipsychotic medications are the most common prescribed psychiatric drug for the psychotic symptoms present in schizophrenics. They're classified into two types, typical and atypical. Typical antipsychotics are first-generation medications that block dopamine receptors in the brain, reducing the total amount absorbed both short-term and long-term. Atypical antipsychotics are second-generation drugs that also target serotonin receptors and are used for a much broader range of conditions rather than just high levels of dopamine, which is associated with the presence of psychotic symptoms. Something I would like to mention that's not in the script is if you talk to a legitimate mental health professional, they will tell you schizophrenia is not actually understood. They believe it is caused by a way too much dopamine being released and then absorbed in the brain, okay? Schizoaffective disorder, the bipolar type, okay? Also the depressed type, right? Depression, when you're depressed, you have a lack of dopamine. So if someone is diagnosed with schizoaffective disorder, say they're the depressed type, right? So apparently the narrative is that they have way too much dopamine, which is causing the schizophrenia, but they also have not nearly enough dopamine because they're also depressed. So, just pointing that out. Okay. Reduction of dopamine absorption, which is what antipsychotics do, both atypical and typical, can help alleviate psychotic symptoms short term, but there are serious consequences of taking antipsychotic medication long term. Approximately 20 to 30% of patients prescribed antipsychotics develop tardive dyskinesia, with higher rates observed in those using typical antipsychotics compared to atypical ones. The risk increases significantly the older you are, and unfortunately, women seem to be particularly at risk. Tardive dyskinesia is a neurological disorder that results in involuntary repetitive body movements such as twitching, shaking, and muscle spasms, and etc. The lower the dose of the antipsychotics and the shorter the duration of time you take them, the better your chances of not developing tardive dyskinesia are. TD can be and usually is permanent, even if the patient stopped taking antipsychotics years prior. Developing permanent, random, uncontrollable body movements from the medication a patient is hoping will help them will of course only make the patient feel even worse, especially since most people are not made aware of the risks of tardive dyskinesia when being prescribed an antipsychotic, whether that would be your first time or your fifth time. tardive dyskinesia is not even the only potential devastating consequence of taking antipsychotics. Studies have proven a gradual loss of gray matter in the brain of patients taking antipsychotics long term. This experiment was originally tested and proven with monkeys. Just do your own research if you don't believe me. The results were so black and white with the monkeys, they were like, okay, then let's do the human trials now. And I really do encourage you to do your own research, especially for that, because I really don't want to list my sources, because the pharmaceutical industry wants the public to think only schizophrenics taking antipsychotics long term will be the ones to lose gray matter. Everybody else taking antipsychotics is all good, supposedly. Despite that being a complete lie, that's one narrative they push to help themselves sell more pills. Unsurprisingly, cognitive decline is also commonly observed in patients taking antipsychotics, which is another potentially permanent consequence observable years after medication stops. Restless leg syndrome is a side effect of antipsychotics where when the patient tries to fall asleep and are on the brink of falling asleep, they'll have a muscle spasm or cramp, often in their legs, hence the name, that forces them to stay awake, wakes them back up, and stays awake due to the adrenaline spike from the pain, the physical pain. This can repeat itself every single time a patient is on the verge of falling asleep all night long, either until their body finally collapses from exhaustion, or they simply just don't sleep that night. Sleep deprivation just makes all mental health symptoms worse. It makes it such easier to slip into mania, especially if the patient cannot sleep for multiple days in a row due to restless leg syndrome, which unfortunately does happen sometimes. Significant weight gain is also commonly observed shortly after the start of an antipsychotic prescription. This is another thing the pharmaceutical industry lies about. They push the narrative that second-generation antipsychotics do not bring the risk of weight gain, or supposedly at least not nearly as much as first generation, which is not true due to how all antipsychotics work fundamentally. These are some of the clinically proven consequences of taking antipsychotics, but there are even more potentially irreversible effects that just haven't had sufficient official research yet. Antipsychotics have been directly associated with the development of hyperprolactemia, which is characterized by abnormally high levels of prolactin in the blood. For women, this may cause galactorrhea, the production and spontaneous flow of breast milk, breast enlargement, and menstrual disruptions, if not amenorrhea, which is the complete stopping of menstruation. If you're a woman and you start a antipsychotic prescription, your period just might stop, which is, obviously not a good thing. In men, it can lead to hypogonadism, which is low testosterone, which often results in erectile dysfunction, decreased sperm production, decreased sex drive, fatigue, and impairment of muscle development. With hyperprolactinemia, both genders share the potential consequences of infertility, diminished sex hormones, sexual dysfunction, breast cancer, including men, cardiovascular disease, and even early development of osteoporosis or other bone complications, because taking antipsychotics, especially long term, really can weaken your bones. If you're watching this as someone with a schizophrenia diagnosis, or maybe concerned that you may be developing it, I recommend taking psychiatry and therapy very seriously. The medication manufacturers want you prescribed their drug for as long as possible. Psychiatrists are not legally allowed to accept payment from drug manufacturers for the purpose of pushing that pill. So instead, the drug manufacturers give gifts, including checks, including just a bank check, to the psychiatrist discreetly and talk behind closed doors. Heavily research any and all medications you're prescribed before ever ingesting it, even the very first time. Please do not start taking any medication before you have done your own serious research into both the short and long-term effects of said medication. Antipsychotics can drastically help short-term, but they can significantly worsen your mental health in the long run. Please take your mental health seriously. Schizophrenics are demonized in all fields of life out of ignorance. And the world of mental health treatment sees you as a cash cow. They want you on as many medications as they can prescribe for as long as you can survive, like as high of a dose that you can survive. That's what they want you at for as long as possible, because they want that money. That's what they do. They don't make that medication that you're popping, every day, twice a day, 3 times a day, every day for 3, 4, 5, 6, 7, 8 years, still having symptoms, still dealing with all this. They're not making that to try to for the good of the public. They want money. That's all they want. That is their only concern. You might not actually need a single prescription. You really might not. That is for you to decide. Happy Halloween.